afternoon, Sat Shri Akal, Namaste. Welcome to another episode of Wellness Time. It's my privilege, it's my honor to once again invite and welcome Dr. Rajeev Malhotra. He's here today, this afternoon, a glorious afternoon, Saturday afternoon, to tell us about his journey and also to give us a few guidelines about certain things and certain challenges that he has faced and is facing, and he's here to guide us all. So, Dr. Rajeev Malhotra, welcome to our show. It's an honor to have you here again.
Thank you, Rani, for having me, and good afternoon, listeners. It's a real privilege to be talking about. Today we're going to talk about a problem that actually Rani has asked me to talk about, lymphoma. Lymphoma is a kind of cancer of the blood. There are various kinds of cancers of blood. This is one of them. And actually, even in lymphoma, there are about 50 odd varieties of lymphomas. And broadly, we divide it into Hodgkin's and non-Hodgkin's. That's Hodgkin's is the name of the scientist, right? And about 10% of the cancers of this lymphoma kind are Hodgkin's. The rest, 90%, are non-Hodgkin's. And it is a journey that we sooner or later will have to face, because it is, I think, about the sixth commonest cancer in Canada for lymphomas. What is lymphoma really? As you see in the background, our body contains various kinds of lymph nodes. What are lymph nodes? They're a collection of lymphocytes, which are cells which fight infection and disease. So this lymph actually is a clear fluid surrounding each cell, and this clear fluid contains cells which are going around trying to find out if there's some foreign particle or some virus or bacteria, and they attack it and eat it. Sometimes these cells go, in common language you can say, berserk, all right? And the problem with that is that now, instead of forming normal cells, these edge out the normal cells out of your circulation. And what does that result in? It can result in anemia, it can result in fatigue, it can result in tiredness. The causes nobody knows really, but there are various kind of problems associated with some kind of autoimmune disorders, radiation, chemotherapy, family history, all these other causes of lymphoma. It is kind of difficult to diagnose because it really has no specific symptoms. Only when you decide, you notice a lump in the neck or a lump somewhere else, and you realize, oh, this is a lymph node, this is where the collection of cells is, and then the doctor sends in for blood tests, and then you find out, or even biopsy. Biopsy is taking a little tissue out of those nodes, and then it is diagnosed. Fortunately, it is now quite a treatable thing, but the initial diagnosis for anyone, including me, who's been a doctor, is quite devastating. For a moment, you really, at that point of time when the diagnosis is given, all hell breaks loose, right?
I can imagine.
Yeah, and
but Dr. Rajeev, I would like our viewers to know the reason why we are discussing this topic in particular. I want you to tell us a little bit of yourself in this journey, and I'm sure it will help many of our viewers too. And that is the
yeah, we're talking about this topic because actually I myself am a survivor of this cancer, and it's been a journey for about 3 years now, out of which about 6 months I've been taking treatment. It is quite a perilous journey, I must say, because your immunity is low, you're susceptible to infections, you feel tired most of the time, an active man like me feels tired. But the thing is to remember always never despair, because we are in Canada, we are in most of the world, we do have treatment for this, and survival rate is very good by cancer standards. And we have to remember never to lose hope. We have Lymphoma Society in Canada, and you can just Google Lymphoma Canada and you can get all the details about it. There are support mechanisms One of the ones that I go to is called Wellspring.
Oh, where is it located?
It's located in Mississauga, in Brampton, and Oakville. It's got various offices
And
there.
what do they do there?
They give you all kinds of support and advise you which paths to take so that you don't despair. The thing is, always remember, it's already lowering your immunity, and despair will lower it further. So the thing is not to lose hope and keep fighting it. It is treatable. The journey is not so difficult as it appears in the first place. But there are fallouts, there's no doubt, but the only option is to fight it.
Of course, you're so right. I would like to tell the viewers, I've been seeing Dr. Rajeev Malhotra for now almost 2 years, and I could not believe that he was suffering from any challenge in his body. You just could not make out. He came to the class, he's a professor, he goes to the class without a break. He has never taken a break. He goes for his chemotherapy and he's back to the class teaching. That's how amazing he is, and that's the reason he's here, to fill us with the inspiration, because we hear that all the time. Okay, you have to be positive, you have to inspire people, you have to inspire yourself, but very few people tell us how to do that. And when we see people like Dr. Rajeev Malhotra, we know that, oh wow, yes, it can be done. We can also inspire, we can also be positive, because positivity is something that you build inside you. Nobody can give it to you. Yes, people like Dr. Rajeev Malhotra, they make us wonder and they make us want to be better every day. So this journey is all about that, and I want him to give us a few guidelines and what he found out in his 2 years of his illness, and how he's going about it, and what are the emotional and physical challenges that he faces, so that we know it can attack any one of us. So we should know how to deal with it. And he's one person that will tell us that no matter what, there is light at the end of the tunnel.
Thank you, Rani, for all those good, kind words. Actually, you yourself are a very inspiring lady, and I derive strength from people like you. And I have got a very good friend, and his wife is a cancer survivor, and she is still so active that it makes me feel that I must do well too. And that's what the message in this wellness time is, that with your doctor's help, please remember that phrase, with your doctor's help, you can go ahead, do anything that you want to do, and there's no point giving up hope ever. In fact, you'll be surprised, I'm very fond of physical fitness, and I keep myself very fit. But these 3 years, not 2 years, actually 3 years that I suffered from this, it was a setback. But I kept going, and after the third chemo, I actually started running again. And I still do my 1 kilometer almost every second day.
Wow,
yeah,
that is something.
This is all inspiration from people like you, and like I said, common people on earth. They really inspire me, and there's no other option but we've got to fight it. And once you decide to fight it with your doctor's help, you can really do it. So remain well always, and the first step towards remaining well is keep yourself well over here. Your mind,
Yes.
Your mind controls almost everything. So keep that healthy, and everything will be all right.
So you told us it's been 3 years since you've been diagnosed with lymphoma?
I was diagnosed about 2.5 years ago, but I was suffering for the past 3 years, and it's nobody's fault that it was not diagnosed earlier, because it is kind of difficult to diagnose. It doesn't present symptoms like fever or something right away. Yes, I had night sweats, but then I'm an active guy, so I thought it's maybe I've exercised in the evening, and that's what I'm feeling hot about. I felt weak, but then I thought maybe I'm a vegetarian and I need to improve my diet, right? So all those things, I did make excuses for myself, and I have to compliment my doctors who went with me all the way, and my hemo-oncologist in Credit Valley, she's also a marvelous lady, and in the journey, my doctors and people like you who inspire me have always been very, very helpful. And that's why I keep going, and I am today doing my physical activity as well as I did before the treatment.
So tell me, how did you land up at the doctor's place? What made you feel that now I'm not really well and I have to go to the doctor?
Yeah, it actually started with a pain in the foot.
Okay.
One foot, and then it got swollen. But when it got swollen, I had traveled to India, and I thought maybe that long journey I hadn't got up enough, and that's what the swelling was about. And I came back, the swelling reduced a little. I kept on doing my exercise, but my foot pain wouldn't go. Kept on inquiring, and then a person like me who's so active, I realized my abdomen is coming out, and that is where I started worrying. I said, what is this? Because this is abnormal for a person like me who's physically fit to have a belly which is coming out, right? And then we got the test done and an ultrasound, and that is what actually revealed this tumor, which was the size of a small football, if you please, in my abdomen, and I didn't know about it all this time. All I had symptoms initially were a little gastric upset, or bowel irregularity, weakness, but I ascribed it to everything other than disease. And fortunately, we discovered it, and fortunately, the treatment, once it was discovered, it was right away they started the treatment process. It was marvelous, the journey, the treatment process. The doctor was so good, I cannot overemphasize that.
Okay, and you said about the symptoms. Tell me, you being a doctor, did it help you to diagnose yourself and go to the
yes, actually,
to your specialist?
You're quite right. Actually, that did, because when you have one limb swelling, you've got to investigate. Is there a block? Like I told you, lymph is the fluid which surrounds each cell, and it is constantly moved towards your body and thrown into the big vessels, big veins in your chest. And I started suspecting there was some blockage in the veins or the arteries in my limb. And I requested my doctor that I need one ultrasound, and fortunately I was a doctor and I knew there was a block somewhere. And
how do you feel when you have a blockage of arteries and veins?
It can give, firstly is the swelling.
Okay.
Because the fluid is not going back properly.
There'll be edema, you mean?
There'll be edema. Edema, I didn't want to use the term edema for listeners. It means swelling in the tissues. And that is what it was. My right limb had almost become twice the size of my left limb, lower limb. So that is cause for concern. Of course, sad to say, the investigative process is time consuming here. I wish it was faster. The ultrasound itself took a couple of months, then there's an MRI and CT that took another few months. So that's how it did get delayed. But nobody's fault. The doctors did everything that they could. Fortunately for me, as a doctor, I recognized that there should be a swelling somewhere, and that fortunately the ultrasoundologist took the ultrasound right up to the upper part of my lower limb, and there she noticed the lump.
Okay.
And that's initiated the process.
So this was about 2.5 years ago?
This was about 8 months ago.
8 months ago?
Yeah.
Okay, that's quite recent.
Quite recent, yeah. I was suffering for about 3 years, but 8 months ago it was diagnosed.
So you've been going through rigorous chemotherapy since then?
Oh yes, chemotherapy, and not only chemotherapy. Chemotherapy does affect people, as commonly we know. Some people lose hair and all. I lost my teeth, and some of the teeth just fell out. It was. It sounds scary. Yes, it is scary, but that's part of the process, and you can't do anything about it. The only thing is, hopefully, you're healthy before that, so that you can take the chemotherapy better.
Yes, like I said, viewers, one look at this person, this amazing person, Dr. Rajeev Malhotra, none of us will ever guess what he's suffering inside. So it's hats off to you. We'll just take a short break and we will be back, viewers. Be with us.
ਘਰ ਲੈਣਾ ਕੈਨੇਡਾ ਦੇ ਵਿੱਚ ਸਾਰਿਆਂ ਨਾਲੋਂ ਵੱਡੀ ਡਿਸੀਜਨ ਹੁੰਦੀ ਹੈ ਜੇ ਤੁਸੀਂ ਪ੍ਰਾਪਰਟੀ ਦੇਖ ਰਹੇ ਹੋ GTA ਏਰੀਆ ਵਿੱਚ ਰੈਜ਼ੀਡੈਂਸ਼ੀਅਲ ਹੋਵੇ ਜਾਂ ਕਮਰਸ਼ੀਅਲ ਹੋਵੇ ਜਾਂ ਇਨਵੈਸਟਮੈਂਟ ਤੁਸੀਂ ਕਰਨਾ ਚਾਹੁੰਦੇ ਹੋ ਕੰਡੋਮੀਨੀਅਮ ਪ੍ਰੋਜੈਕਟਸ ਜਾਂ ਟਾਊਨ ਹਾਊਸ ਪ੍ਰੋਜੈਕਟਸ ਤੁਸੀਂ ਅਭਿਜੀਤ ਸੱਪਲ ਨਾਲ ਕੰਟੈਕਟ ਕਰ ਸਕਦੇ ਹੋ 4166248080 ਤੁਸੀਂ ਫ੍ਰੀ ਇਵੈਲੂਏਸ਼ਨ ਲਈ 416 624 80 80 ਨੂੰ ਕੰਟੈਕਟ ਕਰ ਸਕਦੇ ਹੋ।
हाँ जी की गल ट्रक खराब हो गया घबराने की जरूरत नहीं चले आओ बस ट्रक रिपेयर एंड टायर सेंटर से जिथे कि तुसीं साडे स्टाफ नूं मिलोगे तो उस तो बाद तजर्बेकार साडे मकैनिक ने जिहड़े कि तुहाडे ट्रक दी रिपेयर करनगे असीं दिने रात काम करदे हां इस वास्ते तुहाडी दिहाड़ी नहीं टुटण दिंदे फ्री इंस्पैक्शन फ्री क्लच ब्रेक टेस्ट करांगे फ्री ब्रेकां तुहाडीआं चैकअप करावांगे 1715 सैसमट रोड मिसिसागा जां कॉल कर सकदे हो 905 625 0055 ਜਾਂ ਤੁਸੀਂ ਡਾਇਰੈਕਟ ਕਾਲ ਕਰ ਸਕਦੇ ਹੋ 4166248351 ਬੈਸਟ ਟਰੱਕ ਰਿਪੇਅਰ ਐਂਡ ਟਾਇਰ ਸੈਂਟਰ
ਬ੍ਰਾਈਟਵੁੱਡ ਕਿਚਨ ਜੀ ਹਾਂ ਜੇ ਤੁਸੀਂ ਆਪਣੇ ਕਿਚਨ ਨੂੰ ਹੋਰ ਖੂਬਸੂਰਤ ਬਣਾਉਣਾ ਚਾਹੁੰਦੇ ਹੋ ਜਾਂ ਤੁਸੀਂ ਰੈਨੋਵੇਟ ਕਰਵਾਉਣਾ ਚਾਹੁੰਦੇ ਹੋ ਤੁਸੀਂ ਕੰਟੈਕਟ ਕਰ ਸਕਦੇ ਹੋ ਬ੍ਰਾਈਟਵੁੱਡ ਕਿਚਨ ਦੇ ਨਾਲ ਜਿਹੜੇ ਤੁਹਾਨੂੰ ਕੁਆਲਿਟੀ ਦੇ ਨਾਲ ਫਲੈਕਸੀਬਿਲਿਟੀ ਦਾ ਕੰਮ ਕਰਕੇ ਦੇਣਗੇ ਤੇ ਬਿਲਕੁਲ ਹੀ ਸਹੀ ਸਮੇਂ ਦੇ ਵਿੱਚ ਤੇ ਬਿਲਕੁਲ ਹੀ ਜੈਨੂਇਨ ਪ੍ਰਾਈਸ ਦੇ ਵਿੱਚ ਤੇ ਫਿਰ ਦੇਰ ਕਿਸ ਗੱਲ ਦੀ ਹੁਣੇ ਕੰਟੈਕਟ ਕਰੋ ਬ੍ਰਾਈਟਵੁੱਡ ਕਿਚਨ ਵਾਲਿਆਂ ਦੇ ਨਾਲ ਜਿਨ੍ਹਾਂ ਦਾ ਐਡਰੈਸ ਹੈ 370 ਟੈਪਸਕੋਟ ਰੋਡ ਯੂਨਿਟ B ਸਕਾਰਬਰੋ ਜਿਨ੍ਹਾਂ ਦਾ ਫੋਨ ਨੰਬਰ ਹੈ 4167542844 ਜਾਂ 4163212844
City Car and Truck Rentals. Small cars, SUVs, minivans, 12-passenger vans, Hummer ਅਤੇ ਹੋਰ luxury cars rent ਕਰਨੀਆਂ ਹੋਣ ਜਾਂ ਤੁਹਾਨੂੰ moving ਲਈ U-van ਜਾਂ cargo van ਚਾਹੀਦੀ ਹੋਵੇ ਤਾਂ ਪਹੁੰਚੋ
City Car and Truck Rentals ਜੋ ਕਿ ਸਾਰੀ ਇੰਸ਼ੋਰੈਂਸ ਕੰਪਨੀਆਂ ਦੇ ਨਾਲ ਵੀ ਡੀਲ ਕਰਦੇ ਹਨ
ਵਧੀਆ ਰੇਟਸ ਦੇ ਨਾਲ ਵਧੀਆ ਸੇਵਾਵਾਂ ਵੀ ਦਿੰਦੇ ਹਨ
ਲੋਕੇਟਡ ਹਾਈਵੇ 27 ਅਤੇ ਰੈਕਸਡੇਲ ਬੁਲੇਵਾਰਡ ਕੰਫਰਟ ਹੋਟਲ ਲੌਬੀ ਦੇ ਅੰਦਰ 445
ਰੈਕਸਡੇਲ ਬੁਲੇਵਾਰਡ ਟੋਰਾਂਟੋ
ਔਰ ਕਾਲ ਵਿਕਰਮ ਸਿੰਘ ਕੰਡੋਲਾ 416 812
416-800-1222 or visit www.citycarandtruckrentals.com
ਦੇਸੀ ਦਵਾਈਆਂ ਦਾ ਚਮਤਕਾਰ ਇਹਨਾਂ ਦਵਾਈਆਂ ਦੇ ਨਾਲ ਡੋਡੇ ਅਫੀਮ ਚਰਸ ਗਾਂਜਾ ਸ਼ਰਾਬ ਅਤੇ ਹਰ ਤਰ੍ਹਾਂ ਦਾ ਨਸ਼ਾ ਬਿਨਾਂ ਤਕਲੀਫ ਤੋਂ ਛਡਾਇਆ ਜਾਂਦਾ ਹੈ ਦੇਸੀ ਜੜੀ ਬੂਟੀਆਂ ਨਾਲ ਤਿਆਰ ਕੀਤਾ ਗਿਆ ਹਰਬਲ ਵਾਇਗਰਾ ਜਿਸ ਦਾ ਕੋਈ ਵੀ ਸਾਈਡ ਇਫੈਕਟ ਨਹੀਂ ਹੈ ਔਰਤਾਂ ਤੇ ਮਰਦਾਂ ਦੇ ਗੁਪਤ ਰੋਗਾਂ ਦਾ ਤਸੱਲੀ ਬਖਸ਼ ਇਲਾਜ ਕੀਤਾ ਜਾਂਦਾ ਹੈ ਜੋੜਾਂ ਦਾ ਦਰਦ ਅਤੇ ਮਾਈਗ੍ਰੇਨ ਹੈ ਤਾਂ ਬਿਲਕੁਲ ਘਬਰਾਓ ਨਾ बस कॉल करो 416 425 0138 देसी दवाइयां
Welcome back viewers. So now I go back to Dr. Rajeev Malhotra and I'm really keen for us to understand more about his journey. And so Dr. Rajeev, tell us more about what you went through. What are the changes that you went through before you felt sick and after that? You must have faced a lot of challenges.
Yeah, the main challenge was my active lifestyle was being curtailed. I was feeling weak most of the time, in spite of my exercise, good diet, which I thought was responsible for my weakness, but no. And my foot kept aching. Here I would like to mention, Rani, about the family support. It is very, very important. And I'm really grateful to my wife and my children that I had they were near me. My son flew in from US. That is very important. The first time the diagnosis was given, it was as if somebody has signed my death certificate. Even though I'm a doctor, I was that scared. But please understand, you don't have to get that scared. It is not so difficult. It is not so difficult. Yes, I had symptoms. I had swelling. I couldn't run. I couldn't do my normal activities. And I was tired most of the time. I used to have sweats in the night. My AC, I put it on to 19 degrees and my wife left the room. She thought, what's wrong with this guy? So yes, those are challenges. Even now after chemo I keep feeling weak, but I keep doing my job and I keep doing my exercise routine, improve my diet, and I'm getting there, I personally feel. And with the support system that we have here, it is not difficult. The journey is not difficult as it seems, and not as difficult as it seems.
What is your advice, Dr. Rajeev, for people who don't have that support system, who don't have families, who are alone here, the family is back home in India or wherever in the world, so they are all alone here. So what do they do? How do they manage?
That's a very good question. Like I mentioned earlier, there are a lot of cancer support societies. There's a lymphoma support society. Each cancer has its own support society. You must have seen that pink ribbon thing for breast cancer and all that. In fact, the government, there are a lot of NGOs also who are giving that support. You get a friend circle, you talk about it, you hear the stories of survivors, and then you feel inspired to get on well and get on with your life.
How does a person get in touch with all these people?
Just Google.
Google them.
Yeah,
Mr.
just
Google.
Just good old Google. And Health Canada.
Okay.
You can Google Health Canada. You can Google the exact society that you're concerned with. If you're diagnosed as lymphoma, I did Lymphoma Society, and in fact, I have been trying to volunteer for them too.
Okay.
Unfortunately, my schedule didn't allow it, but they are very helpful. And they are creating awareness. In fact, there is a run for lymphoma in a few days. So this I would want everyone to please go on Google, find out from Health Canada site, find out from various support societies. Just Google that and be careful that they are the right societies.
So viewers, go to Mr. Google, find all this information, and even if you're not facing that challenge, thank God for that, you can volunteer in such organizations and make a difference to people who are going through those challenges, isn't that?
Yes, I would. Thank you. That was a very, very good point. Please do volunteer time for such people. Give them support. If they need just somebody to talk to, well, there you are. And those societies will help you. And you must help. You must volunteer to talk to those patients and make them feel good.
Because I've seen in many families the whole family, the unit, they may not feel comfortable talking to each other because they feel, oh, if I speak to that person, my wife or my children or the husband, I'll be burdening them. So at such times, it always helps to have an outsider listening. Isn't that true?
Very, very true, Rani. I'm glad you gave that lady's perspective on that. It's really beautiful the way you put it. Yes. It is very difficult for the patient at times to talk to his own wife about it, because the minute he talks to her about it, gives her the problems, she really can't do anything about it except get scared and perhaps worried and feel that the heavens are coming down on her. So it's good to go to these societies and talk over there, talk it out and feel good about it. Talk to your doctor. He will give you all the links to these support societies. And do volunteer and understand what Rani rightly said. The family feels very, very lost. They are unable to do anything for you. But so it's a good idea not to worry them too much and get on with your life with the help of your doctors, with these societies, and not worry them. Thank you. That was a very good.
And one more point I would like to stress on, Dr. Rajeev, as a woman.
Yes.
For example, the male member or another member in the family tells a woman the problems, like she's already thinking how to deal with it.
Yes.
And there are times when she will overreact and she may overthink and overanalyze, because that is how we are wired. We are different. So, there are times when the family, the men or the sons of the family may think, oh, she's nagging, she's overreacting. No, it is not that. It is because of the concern, it is because of the care and love that she has for you all. It is that quality in her that makes her react that way. She just wants to take on everything and set it right for you. So viewers, if you have a family member inside your house reacting that way, please don't misunderstand. Know that that person will always be there for you and is just thinking about your well-being and how to end this problem, how to handle that problem. So understanding is something that is required both ends. It cannot be on just one side.
Very, very true. Actually, sometimes your children might be worried and they just express it as irritability.
Exactly.
And it is our duty as the cancer survivors to understand that and not react to that irritability in any negative way. Just understand they are concerned, they are worried. Thank you. That was a very good perspective. In fact, you said Mr. Google. I always say Mrs. Google because it's a lady who knows most.
That's calling it Mrs. Google.
Yeah.
That's quite flattering.
Yes, do understand that the maternal instincts of ladies will always be of concern and always trying to help solve the problems, and really that's what makes the world so beautiful.
Yes, it's just the way each woman brings out her thoughts and voices her concern is different. Each person is different.
Yeah, we need to respect that.
Yes.
We need to respect that very much. Thank you.
And once you understand that, then it becomes simpler.
Yeah, it's all a matter of understanding and positivity. Remember, understand your disease, talk to your doctor, talk to the support groups. Really don't talk about negative things to your family. Please, please, for heaven's sake, don't do that, because that would only create problems in your family. Please don't do that.
But you can talk with the groups.
Yes, with the
that
groups,
you join.
support groups,
Yes.
and talk. And remember, there is nothing insurmountable. That's what is the indomitable spirit of mankind, that we will strive towards wellness.
Because the more negativity you bring into the house, it's going to be very, very tough on your family members.
And going to complicate matters. It doesn't make matters better.
Yes, yes.
So please don't bring any negativity. You have support groups, you have your doctor, you have your talk groups, and the whole idea of this wellness time is this, to bring awareness and inspire people that it is possible to overcome any health problem.
I'm sure some of the viewers must be thinking, oh, so do we pretend? No.
No, it's
Just be yourself.
Yeah.
Yes, tell them you're scared and tell them your concerns, but don't make them feel like they are the losers. It's because of them. It's their fault. It is nobody's fault. It is just a challenge that a family has to go through. And the more positivity that you show, you'll be in a better situation to handle your challenge, which is the disease that we may be suffering from, any disease for that matter. As long as there's positivity, then we can handle it in a better way.
There's no point telling them you're scared. That doesn't help in any way. Don't tell them you're scared. As we say in the army, it's not wrong. It's not wrong to be fearful or scared, but it is wrong not to overcome your fears.
Yes.
So we must overcome our fears, and whatever they are, face them like human beings. We have that indomitable spirit within us, within each one of us,
Yes.
and especially in ladies, of course. So please bring that spirit out, and small concerns, go to your doctor, go to your support groups. You don't have to express your fears to everybody. Whatever your fears are, talk to your doctor, talk to your support groups, and I'm sure you will find help everywhere.
Make sure you have a nice bunch of friends. Even one or two will make a huge difference.
Oh, yes,
Who will take you the way you are, be non-judgmental, and just listen
That's
to
right
you.
about it.
Because sometimes we just need somebody to listen to us
Yes.
without judging us, and that's all is needed to move on in life.
Yes,
So be
right.
that.
Thank you. That was very well put. Yes. So don't be scared. Go get your help, get your support groups, and go ahead. Go on with your life. Life must go on, and in a positive way. That is wellness. First of all, positive thinking. That itself will lead you to success.
Yes, very rightly put, Dr. Rajeev. And it's been a pleasure having you here.
Thank you very
And
much.
you're such an inspiration to our viewers and to us at Mehfil. And may God bless you and your family. And we wish you a very, very speedy recovery.
Thank you very much,
you.
Rani. Thank you, viewers, and wish you all the best and of health and happiness. Thank you.
Have a wonderful weekend, viewers.